Welcome, everyone. Thank you guys for joining us. Welcome. Just letting all the attendees get into the room, and we're going to get right going here. Oh man, so glad that you guys all made it. All right, I'm going to go ahead and get started. Man, we just got to keep piling in. Give me 1 second here. Excellent. Okay. So let me start by just saying hello to everyone and welcome to ELGA Credit Union's webinar powered by our partner Silvur about navigating retirement as a caregiver. I want to share with you guys that at ELGA we are attempting to take a very intentional and strategic approach to retirement education. And so we want to thank Silvur for partnering with us with this information. And we all want to thank all of you for being willing to join and learn about some of this information that really is going to empower you for how to handle and navigate retirement. And so as we get started, right, just a couple of housekeeping things that I want to put on your radar. First, please take a moment to fill out the short poll that you see before you on your screen while we wait for other people to join. If you have any questions during this session, we want your questions. We need your questions. We want to make sure that you walk away from this webinar with the information that you need. So please, right, as you have questions, there is the use of a Q&A feature that is down at the bottom of your screen. We will keep an eye on that throughout this webinar because we want to make sure that we capture your questions and we respond to as many as we can, right? We will also hold a live Q&A at the end. So please be sure to submit your questions anytime during the presentation because we're keeping an eye on those. Lastly, we're excited to share that there is a free tool that is exclusive to ELGA Credit Union members to support your retirement journey. And so we'll highlight how to use this throughout the session. If you'd like to explore it yourself, there is a QR code that you can see there on the bottom left of the screen, or you can visit elgacu.silvur, silvur.com to create your own profile, right? If you're ready to explore that, please do. With no further ado, though, I'm excited to be able to transition and introduce our Silvur speaker. If you were at our last webinar, you have heard her. She has so much excellent information. Rhian is the CEO of Silvur, which provides members like you with retirement calculators, tools, and education through Retirement Simplified, right? Prior to founding Silvur, though, Rhian worked for 17 years at JP Morgan, where she advised individuals and families on investments and borrowing and planning. And so without further ado, Rhian, take it away.
All right, Kevin, thank you so much for welcoming me. I was going to say this morning, but it's already, I think, noon for most of us, so this afternoon. And to all the ELGA Credit Union members, I just want to say thank you for joining us. And for those of you that are acting as caregivers already or are thinking about becoming a caregiver or kind of see that as part of your future, I just wanted to say that, our goal today is to really help you understand some of the decisions that you may be making with a family member, but importantly, understand also how some of the choices that you make to support family members may also impact your own retirement. I think one of the things that we know is being a family caregiver, impacts multiple generations. And so as I go through the conversation today, I'm really going to try to address things that you might need to know for your family members, but also talk about what it means for your retirement, because there is kind of, I would say, this kind of double hit. As the team mentioned, I want to just give you a little bit of context that we have a lot of this information already online through the ELGA experience of Retirement Simplified. Through Retirement Simplified, it's one place that you can go to get all the education that you need around retirement. At the heart of it, we help you understand how long your savings will last in retirement and understand what your estimated Social Security benefits look like, Medicare costs, how you can project spending in retirement. We also have a lot of education in there, whether it's topics on long-term care, it's navigating Medicare, Social Security, taxes, and retirement. So that's, as we go through again today, I just want to make you confident that this information can be found online. And if there's specific topics that you want to dive deeper on, we'll definitely aim to address them in the Q&A, but we will also make that available for you offline. So let's talk about what some of the topics are that we're going to cover today, just so you kind of get a sense of kind of the arc. And I know that for some of you, you may be experts and you've got a very specific question you want to answer. And for others, you may be earlier in your journey. So we're going to try to really strike the balance and cover both sides. We're going to talk just big picture about kind of retirement for caregivers. And then I'm going to go into kind of key Social Security decisions, really making sure folks understand Medicare versus Medicaid. We're going to talk about some of the legal documentation that's important to have in place as a caregiver, and then we'll end with a checklist. Um, I do want to just start out by saying that for folks on the phone today that may be already acting as a caregiver, many of you may have seen that caregiving can often escalate from what starts as something part-time and a few hours a week to almost becoming, in many cases, a full-time position. And I want to say that because I think for many folks, they step away from the workforce for a period of time, thinking that they'll be able to address a family situation, but they plan to get back into the workforce. And for those that find themselves unable to get back in the workforce because they need to spend more time with a family member, there can be some real implications on retirement security. I think it's obvious, when you kind of leave the workforce early that there's this loss of income. But there are some, I would say, less obvious implications, things like not continuing to accumulate Social Security credits, needing to potentially access non-employer health care. And so as we talk about kind of this topic today, we're going to talk about some of those topics so that you're really thinking about, I think a lot of folks who are caregivers, do such an amazing job taking care of family members that they forget about themselves. And I want, when you walk away from this webinar today, for you also to be thinking about yourself and how we make sure that we're protecting your own retirement security. So let's talk a big. I'm going to kind of hit the basics on Social Security. I think for most folks on the phone, if you've been employed in the workforce, you probably know that there's a Social Security payroll tax, right? That every 2 weeks, about 6.2% of your paycheck is going into Social Security. What I would just say is when you think about Social Security and you think about retirement, it's a pretty valuable retirement asset. I think about it in many ways like a forced savings program that we're all paying into. But it's one of the most valuable retirement assets that Americans have today. It's guaranteed lifetime income. So whether you or a family member lives till 80 or 90, 100, it continues for their entire lifetime. It has inflation protection. So every year that benefit either remains flat or increases. And so when we've seen periods a couple of years ago of pretty rampant inflation, we saw pretty significant increases in Social Security payments. Social Security is not just there for you as an individual, but it's also there for your spouse and also for survivors. And we'll talk about kind of how those benefits work, particularly if you're thinking about taking care of a family member. Social Security is, for many folks, one of their most valuable assets, but sometimes the math isn't as obvious because it comes in every month. But one of the things to think about is that a Social Security benefit of about $2,500 a month adds up to $600,000 over the course of retirement. So when you think about it from like a lump sum perspective and you think about, a 403(b) or a 401(k) or an IRA, this asset is really valuable. It's just coming in as a monthly paycheck. And so when you think about kind of the total value, for most folks, it's actually their largest retirement asset. I'm going to spend some time just talking about some of the decisions you make when you elect Social Security. This may also help you understand a family member's Social Security, whether they've elected already or they're thinking about electing. The first thing to really understand is that you're able to elect Social Security between the age of 62 and 70. Today, full retirement age is the age when you're eligible for your full benefit. And for most folks, that is 67. If you're caring for an older family member, they might have told you that their full retirement age was 65 or 66. And that's most likely correct because it used to be that the full retirement age was a little bit younger, and now that date is currently 67. You or a family member is able to elect Social Security again between the age of 62 and 70. If you elect Social Security before the age of 67, what you see is the benefits are reduced by 6% per year. So you'll receive 70% of your benefit when you elect at 62. You can grow your benefit by deferring it. And so your benefit can grow to 124% of that base benefit up to the age of 70. We'll talk a little bit more about kind of, again, how spousal benefits work, but just something to be aware of is that When you elect early, you are locking in lower benefits for survivors, as an example. So, if one party elects early, then the survivor benefit later down the road will also be reduced. And so I always think about it's your own election that you're making. But because Social Security has spousal and survivor benefits, that decision you make can also impact your spouse. So there are a couple exceptions of when you can elect Social Security earlier than 62. The first is if someone is a survivor, they can elect at age 60. If someone is a survivor with minor children, they can elect at any age. And then while today I'm not going to spend time diving into disability for Social Security, the election for disability benefits really depends on the date of disability. So let's talk a little bit about how Social Security works. If you are single, you're eligible for Social Security after earning 40 credits. That typically means working over a 10-year period. It doesn't mean that you have to work for 10 years straight. You could work for 2 years, take some time off, work for another 5 years, take some time off. It is not full-time work, so you need to earn about $2,000 per quarter. So Social Security actually tracks how many quarters that you work. Um, your benefit is based on the highest 35 years worth of earnings. So let's say you worked for 40 years, maybe you had it's summertime now, you had a summer job, maybe working by the lake. And when you were a kid, you were 17, 18, you earned a couple $100 for the year. But let's say that you had earnings that were higher later on in life. What Social Security does is they look and they say, well, look, here's your highest 35 years worth of earnings, and those are the earnings that we're going to use to calculate the benefit. Social Security recognizes that there's been a lot of inflation, so $1,000 earned 40 years ago is different from $1,000 earned today, and so all of that is inflation adjusted when they make those calculations. If you or family members are married, again, folks are eligible after working for earning 40 credits as an individual, or if their spouse worked for 10 years. And then the benefit is calculated on the higher of your benefit, which again is based on that 35 years worth of earnings, or 50% of a spouse's benefit. So you may have a family member today where you have, maybe your mom and dad, one of those parties did not actually work outside the home. Maybe they raised children as an example. And so they may not have a work history, but they are eligible for a spousal benefit. And again, that spousal benefit would be 50% of what their spouse's benefit is. For folks who are divorced, the calculation is quite similar to the married benefit. The only difference here, I would say, is that the ex-spouse benefit, again, is 50% of your ex-spouse's benefit, as long as you were married for 10 years and have not remarried. The key thing here is this kind of threshold of 10 years married. For survivors, and this is one I would just flag for those of you that are acting as caregivers, is really important to know, is that survivors, again, are eligible based on their own earnings history or based on their spouse's history. The difference between a survivor benefit and a spousal benefit is the survivor benefit is actually 100% of the spouse's benefit. But the important thing to know here is that you don't get your benefit plus a survivor benefit, you get the greater of. So what many households actually experience when a spouse dies is that their Social Security benefits drop because they go from receiving 2 Social Security benefits to receiving just 1 benefit. And so while the surviving spouse's benefit likely increases, they are losing what was their prior benefit. And so something just to be really aware of is that, again, when a family member does die, if they're in a 2-person household, that you are likely to see that their Social Security benefits will drop in aggregate when their spouse dies. I just want to quickly address non-marital relationships. Social Security does recognize some non-marital relationships, things like civil unions, domestic partnerships. They look to the state law. So if the state law recognizes that partnership as a marriage, as a legal marriage, then you are able to access the benefits that a spouse or ex-spouse or survivor would have accessed in Social Security. As what always happens with Social Security, there's a lot of, I would say, devil in the details. So a couple things just to be mindful of. Spousal benefits, you need to be married for a year in order to be eligible. Ex-spousal benefits, you need to have been married for 10 years. And for survivor benefits, you need to have been married for 9 months. There are some special carve-outs on survivor benefits if you remarry after the age of 60, but for folks that remarry earlier, and the survivor benefits kick in if you've been married for 9 months. One of the things that and I think probably be less relevant for folks that you are acting as a caregiver for, but more for yourself, is that we often have people say to us, "Oh, well, I'd like to elect my benefit, but not my spousal benefit." And what people are trying to think about there is they're really trying to almost like, I'd say, game the system, which is, well, I'll take my benefit early and I'll defer my spousal benefit so I can try to get that benefit to grow. And that used to be a loophole. There was a term called file and suspend that, if you have family members that are, I would say 80 years old or older, they might have filed and suspended. But that loophole was shut. And so today, when you elect your benefits, all of your benefits are being elected at once. And the government is deciding which benefit, or just determining which benefit is highest and providing that to you. The one exception is a widow benefit. You can actually elect your survivor benefits separately from your own benefits. So as an example, you could elect your survivor benefit first and then let your own benefit grow and switch to your own benefit at age 70, or vice versa. You could elect your benefit first and then later down the road switch to your survivor benefit. So that's the one that you can decouple. And so if you're helping a family member who has had a recent kind of a death of a partner, and perhaps they're in their 60s and they're trying to figure this out, that is the one where it does make sense to spend some time looking at which benefits should they be electing, and does it make sense to kind of decouple. That does not work again for spousal or survivor benefit, or sorry, spousal or ex-spousal benefits, but it does work for survivor benefits. I've talked a little bit about maximizing your benefit at age 70. Again, the question of whether it makes sense to elect is not just about maximizing the annual benefit. There is this math around thinking about how long you're going to live. If you think you're only going to live until 70, then actually electing early at 62 can make a lot of sense. If you're like me, women in our family live until we're 100. And so actually deferring our election makes a lot more sense so we can try to grow that benefit. I did want to flag, though, that if you are expecting to receive a spousal or an ex-spousal benefit, that there is no additional accrual after the age of 67. So you earn that maximum benefit at age 67, and so delaying until 70 isn't kind of a factor in that thinking. All right, so a couple things I want to just flag for folks as a caregiver that I think are really important to think about. The first is that unfortunately, unpaid work as a caregiver does not allow you to accumulate Social Security credits. There has been a lot of talk in Washington around providing caregiver credits, but today that is not the case. And so when you take time out of the workforce to care for a family member, I think oftentimes that you're losing your income, but I would also just flag that you're losing that Social Security credit that you want to accumulate. So that's really important to think about. The second is, if you actually choose to elect Social Security early, because perhaps you've like left the workforce caring for mom and dad, and you choose to elect Social Security for yourself so that you can start some income, I do want to just make sure that you know that you can't then change your election strategy down the road. There's one time when you can stop your election, but basically you have one chance to elect. And so I always say to folks, before you elect, really try to make sure that you think you're going to stay on Social Security, that you can't start it and stop it multiple times. All right, for family members, a couple things to think about as a caregiver. So the first thing just to be aware of is that Social Security is direct deposited. It used to be that Social Security checks came in the mail. It is highly unlikely that your family members are still receiving Social Security checks in the mail, because the government, probably starting about a decade ago, started forcing direct deposit. So the first thing is that if you are acting as a financial caregiver for a family member, you can also work with the credit union as you think about consolidating accounts and simplifying the financial picture to work on switching the direct deposit. And so there's a very simple process that the credit union can help you with there as you think about perhaps acting as a financial caregiver for family members. Um, Second thing to be aware of is if your family member is moving, just make sure you understand whether they're moving to a state that taxes Social Security. Over the weekend, you may have heard about the One Big Beautiful Bill Act. And there were some statements in the press that I would just say that were not completely accurate. There were some statements suggesting that Social Security was no longer going to be taxed. The reality is it's still going to be taxed, but there is a new temporary deduction that will offset taxes for many Americans. I do want to flag that not only is Social Security taxed at the federal level, but it is taxed in a lot of states. It's not taxed in the state of Michigan, but depending on where mom and dad may or may not be moving, just be mindful that to kind of take a look at that. Third thing I want to just flag for you as a caregiver is just making sure that mom and dad have automatic withholding in place. One of the, again, kind of crazy things with Social Security is that withholding isn't automatic. You actually have to specially request that there's withholding. If there isn't withholding, that means that you have these potential tax liabilities at the end of the year. So if you're doing kind of a check with mom and dad and you just want to make sure that everything is set up properly, I would just make sure that they have automatic withholding in place. Otherwise, you might have to start filing quarterly tax returns. You can apply to become an authorized representative. It allows you to take actions on behalf of a family member and support them through Social Security. If you are navigating the death of a family member, the payments to the deceased should stop automatically based on a notification from the funeral home. If for some reason that has not happened, the obligation is on you to return the checks to Social Security. So again, this is where I would just triple check that those checks have stopped or the deposits have stopped. The other thing is that there should be an automatic switch from spousal to survivor benefits. But I think it's always worth checking. And this is where you may need to go with a family member to the Social Security office to make sure that the switch is happening. Um, I will say, having been to the Social Security office recently, it takes quite a bit of time on the phone to get an appointment. You can't just book, you actually, most Social Security offices today require an appointment in advance. You'll find yourself probably on hold for a couple hours to get that appointment for a family member. But I do think that accompanying your family member to the appointment can be really important to help them advocate and to make sure that they're getting what's due to them. But again, here I would just say, just make sure the checks, like you're not getting additional direct deposits because the government will require you to pay that back. And they do have some pretty hefty fines associated with not kind of paying back those payments. All right, so I'm gonna switch from Social Security and I'm just kind of keeping an eye on time. So I know we're moving through a lot of topics, but I want to save some time for Q&A. I'm gonna move from Social Security over to the basics of Medicare and Medicaid. Um, I think sometimes folks throw the phrase Medicare and Medicaid together in one kind of big lump sum and don't differentiate the two. And I want to just clarify that typically from an eligibility perspective, your family members that are on Medicare typically have contributed into Medicare through their payroll taxes, either them or a spouse. They will be paying sometimes up to $500 per month, and we'll talk a little bit about how that works just based on the different plans that they have. And important for you to know as a caregiver in particular that every year between October and December, they have the ability to review their plan. This is really important as a caregiver because often what we find is that carriers change what prescription drugs are covered. And if you don't review your plan every year, you might find that you have an increased out-of-pocket costs because your prescription drugs are no longer covered. So that's something just to be really mindful of. The second program is Medicaid. This is really managed at the state level, whereas Medicare is mostly managed at the federal level. Medicaid typically has asset and income limitations. It often will have lower costs just based on family members' assets and income. I will just flag to you that many folks when they think about paying for healthcare long term, they do think about like can they help their family member become eligible for Medicaid by spending down assets. The first thing to know is that historically you've had to have an actual annual income update. Out of the new bill, actually that update's going to be every 6 months, and so you're going to have to requalify for Medicaid on a pretty regular basis. As a caregiver, you're going to have to stay on top of that for your family member. The second thing is that if you are trying to qualify a family member for Medicaid, just know that there is a 5-year look back. And so if you transfer assets to a family, to other family members, and then the family member dies or needs long-term care, it takes 5 years to actually truly qualify that those assets are kind of out of your family member's, let's call it, balance sheet. Um, you may have a family member that's what's called dual eligible. So some family members are actually dually enrolled in Medicare and Medicaid. And so there are scenarios where folks actually are enrolled in both programs. The first thing I want folks just to really understand is that Medicare is not free. I think oftentimes, we think about paying payroll taxes. We also think we see a lot of advertisement that suggests that there are these zero premium plans. And I would just say to you that zero premium does not mean that there's zero cost. The average, what I would call fully loaded plan for Medicare costs about $500 per month per person. And that's when you think about adding Part A, Part B, kind of all the different components together and thinking about what your out-of-pocket costs might be, as well as kind of additional insurance. The other thing is that your costs can actually vary by zip code. So it could be based on where like your Medicare costs, if you're in your 60s, could be quite different from a family member's in their 90s if you're living in different places. And that's because the plans are different based on where you live, and also the costs are different based on where you live. I want to just talk a little bit about like the alphabet soup of Medicare. And again, in our experience, we have a lot more information here. So just know that we have a resource here for you to be able to access. Um, at the starting point, we'll talk a little bit more about Part A and Part B, but this is what's oftentimes called original Medicare. This, your family members will have enrolled through the government website, typically through the Social Security website. They enroll in Part A and Part B. But Part A and Part B don't cover everything. And this is where folks often add an additional plan. It might be a Medicare Advantage plan, which tends to be more like an HMO, a bundled solution, tends to have lower premiums but higher out of pockets. Or your family member may enroll in what's called a supplemental plan, which looks more like a PPO, typically has higher premiums but lower out of pockets. Part A and Part B does not cover prescription drugs. So most folks are also adding a prescription drug plan. It either can be bundled with their Medicare Advantage plan in what's called an MAPD plan, or it can be available as a standalone plan. So let's talk a little bit about what Part A and Part B covers, and then we'll kind of dive into Medicare Advantage and Medicare Supplement. So Part A, you can think about this as inpatient care. So this is, inpatient hospital stays, some home health visits, some hospice care. The premium in 2025 is $0 per month, provided that you actually qualify for Social Security. So if you've paid into the system for Social Security and Medicare, Part A benefits, or Part A does not have a premium, but there is a deductible. For Part B, you can think about that as kind of out of hospital care. So things like physician visits, outpatient services, preventative services. In 2025, that Part B premiums are $185 a month. There's also a deductible and co-insurance. And so the starting point just for Part A and Part B is about $185 a month in monthly premiums. For family members who are low income, there are some premium subsidies where the Part B premium can be paid by the government. And so that is something to look into if you have a family member that is low income, that they may qualify for that premium subsidy. So as you can see here, there are parts, there's things that are not covered. Prescription drugs are not covered. There's also out of pockets and co-insurance. And so this is where the other programs start to kick in. And again, the choices that you have typically are go the Medicare Advantage or the Medicare Supplement route. These plans are actually based on where you live. So again, if you're taking care of a family member, it might be that they have a carrier or a plan that's not available to you personally. So those plans the prices and the availability are based on where you live. The plans are, again, quite different. I would just flag for Medicare Advantage. Medicare Advantage optically feels like it's cheaper because the premiums tend to be lower. But just be mindful of the fact that even though there's lower premiums, there tend to be higher out of pockets, and there often is more limitations on your provider choice. The Medicare supplement plans, again, look a little bit more like a PPO, more full service. The one thing just to be super mindful on Medicare supplement is that when you turn 65 for the first time, you can elect any plan you want. After the age of 65, so whether it's for yourself or a family member, Medicare or Medicaid supplement plans are allowed to medically underwrite you if you want to switch your plan. So let me just say that again. At age 65, you are able to enroll in any plan. But if you choose to switch your supplement plan after the age of 65 or maybe elect it for the first time, they are allowed to medically underwrite you. That means that like if you've had a recent health history of cancer or any sort of expensive health issues, the carrier may decline you. Medicare Advantage is always available, but really important to think about at age 65, like if you feel like you want more choice in your healthcare, typically more choice guides folks to a Medicare supplement plan, but it is typically a higher monthly premium because you're paying almost like the full fee up front rather than paying it, pay as you go, which is more what Medicare Advantage feels like. On the prescription drug side, I would say that 90% of Americans have a prescription drug plan. It covers, specific drugs that are not available under the Part A and Part B. Again, like Medicare Advantage and supplemental plans, availability is priced based on where you live. The key thing here is you may be aware that there's been a lot of negotiation between the government and carrier slash prescription drug companies around what the prices are for prescription drugs. One of the things that we've seen as that price negotiation is happening is that carriers are pretty quickly changing what drugs they cover in their plans. So last year, as an example, we saw a lot of folks experiencing very big changes in whether or not their prescription drugs were covered under their plan. So if your drug is not covered, then you basically have much higher out-of-pocket costs. So really important for you to keep on top of with family members. Every single year, they get what's called an annual notice of change. It tells them what's changed about their health plan. And a really important time, particularly for family members that are using prescription drugs, to check and recheck that their prescription drug needs are actually covered under their plans. So as we think about just budgeting for Medicare, I typically advise folks to be thinking about Medicare as costing between $500 and $600 a month. You'll see on the right-hand side how we kind of came up with those numbers, which is looking at the component pieces, the Part A, the Part B, the prescription drug plan, which is Part D, and then, a supplemental plan in this particular case. Um, Again, with a supplemental plan, you're paying that premium. And the idea is that you should have, low out-of-pocket costs because you're paying kind of a higher monthly premium. The numbers for Medicare Advantage, frankly, aren't that different. When you think about kind of a full year, the difference is how you pay. So a Medicare Advantage plan tends to have lower premiums, but you could be paying, $500 plus per month in out-of-pocket costs. I think the key thing here to think about is if you have a family member that is a high healthcare user, you really have to think carefully about whether Medicare Advantage or Medicare supplement plan is the right thing for them. I know folks that are on a tighter budget often will choose a Medicare Advantage plan because the monthly premiums are lower. But just be mindful of premiums, again, are not the total. You have to actually factor in what your out-of-pocket costs might be. I did want to also just flag for you that the numbers that we've just walked through are baseline numbers. If you're in a position where you have higher income, there are what are called IRMA surcharges, which are surcharges to your Part B and Part D premiums. And those are applied to higher income earners. There are some, I would just call it like life events that can trigger that IRMA. And so just to be thinking about if you have a family member, if you're taking care of a family member and you sell a home to move them into a nursing home, as an example, that sale of the home can trigger the IRMA surcharge because the proceeds from the home sale can trigger that. Distributions from an IRA can trigger an IRMA surcharge. Things like Roth conversions can also trigger the IRMA surcharge. So it may be that you think about a family member as not being high income, but there are certain things that are happening in their life and their financial picture that could temporarily move them into this IRMA surcharge for a couple of years. We talked about this already, but I want to just double tap on it that all of these plans are priced based on where you live. And so there is a decent amount of variability. I would say the variability I've seen is anywhere from $400 a month to about $700 a month is kind of like the main range that we see these plans really falling within. I did want to just flag that when we talk about Medicare, it covers things like hospitalization, skilled nursing, home health care. Really important to know that it does not cover long-term care. And that is long-term care outside of like post hospital rehab. This is frankly just the big issue in America today, which is, long-term care is very expensive. It often is the point where family members are spending down a lot of their assets to cover long-term care. But I did want to just flag it that if you don't have a long-term care policy, you do need to know that until you qualify for Medicaid, long-term care is not actually covered under these plans. So when we think about Medicaid, a lot of folks will often think about qualifying for long-term care under Medicaid. Medicaid has pretty strict income and asset tests. The tests vary a little bit based on the state that the family member is residing in. Again, the recent One Big Beautiful Bill Act that was passed has more stringent qualifications and recertifications for Medicaid eligibility. Today, about 30% of the spending under Medicaid is actually to cover long-term care. So it's a very significant cost in America, and is, I would say, just the reality of all of us living longer is that we're seeing pretty significant long-term care costs across the nation. I did want to flag just on the Medicaid side that there are a number of programs available in the state of Michigan, and these are offered through the Department of Health and Human Services. We'll send out some links at the end of this webinar just to kind of give you some resources. But again, through the Department of Health and Human Services, they are the organization that are determining eligibility, checking your income, your assets, your citizenship status, and also making sure that you requalify so that, if at some point in time your income changes and you're no longer eligible, that you're flipping back to kind of more of a Medicare coverage model. Things that I'd want you to all think about as caregivers for your own retirement is that if you find yourself leaving the workforce early to care for a family member, you'll need to look at enrolling in COBRA or ACA. You cannot enroll in Medicare until you're age 65. There are some exceptions to that around folks with kidney failure, but I would say for 99.9% of Americans, you can't enroll until you're 65, even if your spouse is enrolled. So, in my case, my husband is 5 years older. He will enroll in Medicare 5 years before I'm eligible to enroll. So take a look at COBRA and ACA if you're thinking about leaving the workforce. The one thing I would flag on the ACA side is ACA plans are priced based on your age. The average premiums for a 60-year-old are north of $500 a month, usually closer to $600 to $700 a month. That is a lot more than if you've been helping cover an ACA plan for a younger family member. Those plans tend to be priced at closer to $150 to $200 a month. There are some subsidies for ACA. Again, a lot of the belt tightening over the weekend that we saw in the new bill is around who does and doesn't qualify for those subsidies, and also recertification of qualifications. So definitely take a look at that, because I think what we do see is that a lot of folks, when they see how expensive ACA is if you don't qualify for a subsidy, we see a lot of folks, excuse me, a lot of folks actually going back to work part-time and looking for part-time jobs that will provide them with healthcare to bridge to Medicare. A couple things I want you to think about for family members. We talked about this authorized representative. That's really important also for Medicare so that you can do things on behalf of your parents. Important to understand in and out of network. A lot of the Medicare framework is around staying in network. The minute you go out of network, costs can skyrocket pretty significantly. Important for you to help family members with this, because doctors may shift in and out of network and they may not be aware. I've talked about this a couple of times, but I want to just double tap on it again, which is making sure to understand the difference between a premium versus costs. So premium is what you're paying every month, but it does not factor in co-insurance out of pocket. True cost is what I think for most of us really matters from a budget perspective. Want to flag that, we've talked about some of these premium subsidies. So if you have family members that are low income, they may qualify for a subsidy. And then finally, I did mention this, what's called the ANOC, the Annual Notice of Change. Every year, if you are helping a family member, I would encourage you to look at that ANOC with them and check to see whether their prescription drugs, for example, and their health needs are covered by the plan they're on, or whether they need to reevaluate and look for a new plan. Okay, I'm going to talk a little bit about legal documentation, and I did want to flag that we're going to open up for Q&A pretty soon, so feel free to drop your questions into the Q&A. Um, you know, I think as we go through from a caregiving perspective, I think many folks on the phone will probably understand, the importance of having a will. It really ensures that your family members are that the assets are going to the people and places that they want them to go to. If you don't have a will, the state determines where your hard-earned assets and savings go. I think for many folks, it's important to take another look at your will if you already have one, but take another look in your 60s and 70s. A lot of your family fact patterns may have evolved. I know for me, my will was really centered around guardianship for my children. But as my kids get older, I'll be thinking about kind of different things as I think about my will. Important to think about if you're acting as a caregiver for a family member that you really have a conversation about whether a power of attorney makes sense. In particular, the medical power of attorney, which is often called a advance directive or healthcare proxy. It allows you to make decisions about a family member's healthcare or medical treatment if they're not able. It's a good document to have in place for yourself, but also something to really have a conversation with your loved one about, which is who is the person that's going to be able to make these decisions, if they're unable to make the decisions themselves. Designating beneficiaries is something that I highly recommend, and it's something that I think just super simplifies the probate process. So accounts like IRAs and 401ks, you can name a beneficiary, and by doing that, you're able to take the assets out of probate. Really important for a spouse, if if you want to make sure that they have easy access to assets after you're gone, that those accounts have beneficiaries listed. Again, if you're acting as a caregiver for a family member, really just checking to make sure the beneficiaries are up to date. Oftentimes, people put a beneficiary on an account 20 or 30 years ago and they forget about it. And so it's really important to take a quick check and make sure, like, are these still the beneficiaries that you want to have? You can also add a secondary beneficiary. This is important where, a lot of times people list their spouse as the primary beneficiary. But if their spouse has died before them, the question is, well, who is the next beneficiary? So we just encourage everyone to take some time to like review it. Really important to do it when you've got, new members of the family, when there's been a death, and also when there've been divorces, just to really make sure the assets are going to the people that you intend them to go to. As you think about estate planning for family members, I do want to just make a general comment that when family members are moving, you do need to take a moment to re-review any estate planning that they've done. Oftentimes, moving from state to state can actually invalidate some of the estate planning that they've done. So a lot of times, really important, particularly if you're going into a community property state, that you've really looked at the documentation to make sure that the documentation works in the state that you're now living. I talked a little bit about community property states, but again, there's community versus common law. Here are some of the community property states. Again, important if family members are moving to or moving from these states that you've re-reviewed their plans to make sure that the assets are appropriately documented. Talked about a couple different documents, but as you think about your role as a caregiver, some of the documents that are just important to think about: a power of attorney, living wills, HIPAA authorization, making sure that mom or dad has a will. And there may also be an opportunity to put what's called a caregiver agreement in place. This might be a document that allows you to be paid as a caregiver for taking care of mom or dad, and really documents how that care and that compensation is being managed. All right, I want to just talk a little bit about a caregiver checklist, and then we're going to end with saving, I think we've got a good 10, 15 minutes for questions. So some of the topics that we talked about today, I want to just talk about Social Security. From your perspective, I want you just to really understand how caregiving impacts your benefits. If you leave the workforce early and you need to then elect Social Security early, just understanding how that might reduce your benefits. For family members, it's just making sure they get the benefits that they are entitled to. Specifically, when a family member dies, really making sure that your loved one is getting their survivor benefit, and also making sure that you aren't inadvertently continuing to receive the deceased member's payments. On Medicare, important to spend some time researching COBRA and ACA if you plan to retire before the age of 65, so that you understand what those costs and coverage look like. I think for family members, the most important thing I would say here is just because they have a plan doesn't mean they're set for life. You really have to review those plans every year to make sure that the family member is still getting the coverage that they need. On the long-term care side, if you are providing in-home care to your family member, we're going to send around some links after the webinar today. There are family caregiver support programs where, depending on the state that you live in, you may actually be able to be paid as a home care provider for a family member. It's also important to see whether family members qualify for state support. There are a lot of state programs out there that are intended to provide support for older family members. And then on the estate planning side, the question is, do you have a plan and is it up to date? And then I think importantly for your family members is like, is their plan up to date? And does it address the healthcare decision making that ultimately, becomes quite relevant later in life? All right, so we've covered a lot of information today, and I was moving, I know, pretty fast because I wanted to make sure that we saved some time for Q&A. I did want to just flag that the content that we've covered today is actually available online as a member benefit through Retirement Simplified. You can see the URL here, elgacu.silvur.com. You can log in, create a profile, and access this education. It's constantly being refreshed. So as an example, over the weekend, we released a summary of the One Big Beautiful Bill Act so that folks really understand how their Social Security benefits will be taxed under kind of that new bill. We'll be releasing a class later in the week that covers the implications on Medicare, Medicaid, and ACA under that act too. So just want to say thank you also to Kevin and the team, because I think by making this available for you, I think that the credit union is really showing that they care and understand that this is a complicated phase of life, and making this resource available to you. So with that, Kevin, I think I want to pause and see what questions we have, and make sure we're addressing what's on members' minds.
Absolutely, absolutely, Rhian. Thank you for such amazing information. We did have one question that just popped in here. Vicky is asking, can you give a little bit more information on the caregiver agreement?
Yeah, so a caregiver agreement, I would say, is a pretty flexible document. It's not a preordained, like, here's what it looks like. But I would just say that increasingly what we're seeing in families is that typically one family member takes the primary burden of acting as the caregiver. And so in many families, we're starting to see folks think about, okay, well, that financial obligation is disproportionately impacting one individual. So family members may be collectively paying a family member, so it's everyone contributing in to pay that individual that is acting as the home health care provider for your family member. It could be that I would say probably one of the most thoughtful caregiver plans I've seen was a gentleman who kind of knew the industry. He actually owned nursing homes, and he had put in place a trust to pay a family member for providing in-home care, because he recognized that typically caregivers aren't getting paid, and he wanted to make sure that that individual's time was being compensated for. So I think a lot of the caregiver agreements, what's really important there is to, as a family, sit down and have that conversation and document it. I think there's unfortunately lots of situations where after the facts, people are questioning how certain payments are being made. And by documenting in a caregiver agreement that, look, we've agreed that you're going to get paid $2,000 a month for providing these services and helping mom or dad, get to the hospital, to do all these different things, then there's no questions about why money was being transferred from mom and dad's bank account to your account. So I think that I would just say is it's not as prescriptive as a will typically is, but it's just thinking about as a family, if you're going to act as a caregiver, do you want to document particularly any money movement? Because it's typically the money movement between mom and dad's account and perhaps your account that becomes problematic down the road when folks feel like perhaps they didn't understand what was going on. It also, I think, allows for a conversation with other family members about the reality that the primary caregiver is often has a pretty significant burden that's been placed on them that other family members are not undertaking.
Awesome information. Next question that we have here is, looks like as a caregiver, how would I know if I qualify for caregiver benefits in Michigan?
Yeah. So in Michigan, there's a couple different programs, and we'll send out links to these afterwards that support caregiving. There is the Michigan Choice Waiver Program that offers in-home support for eligible family members that would otherwise need nursing home care. There's the Home Help Program that pays caregivers to assist Medicaid beneficiaries. And then there's the Family Caregiver Support Programs that often will provide training, support, respite care, and that's typically managed through the area agencies on aging. What we'll do after the webinar is we'll send out some links so that you can take a look at these different programs and see whether, one of these programs kind of matches the specific fact pattern that you're addressing.
Thank you for that. Next question that we have is, what are the key differences between premiums and costs when it comes to Medicare?
Yeah, so that's a really good question, and I want to just double check or to kind of just double tap on the premium is kind of like you think about your health care plan today. If you have an employer plan, it's the premium that you pay every single month. But what you probably know is that your premium doesn't cover everything. You might have out of pockets, you might have co-insurance. With Medicare, it's very much the same, which is the question is, what is your monthly premium and how much is covered and not covered? And so the conversation we had today is just really understanding that sometimes when folks are enrolling in Medicare, they focus a lot on the premium and they don't understand actually that a lower premium might not actually mean lower cost. If you're someone who has, I would call it like high healthcare needs or high healthcare usage, you might find that it's actually lower cost for you to pay a higher monthly premium to make sure that you have lower out-of-pocket costs. And so again, I think the most important thing here to think about is don't get wooed into zero premium and think that it's free. There is no free lunch, right? There are additional costs, and make sure you think about, okay, well, what is the total cost that I'll be paying that I need to budget for?
Gotcha. Okay. I've got another question come in live here. Vicky is asking, how do we handle being a snowbird, especially related to caregiver benefits?
Yeah, so like the snowbirds, let me kind of tackle snowbirds in lots of different angles. So the first thing I would just say is that when folks think about being in multiple places, whether it's a family member or you, ultimately you have to have one domicile from a tax perspective. So if you split your time between Michigan and Florida, you ultimately have to tax domicile in one state. And so where you tax domicile, either Florida or Michigan, is the place that you enroll in Medicare. So that's super important to know both for yourself and for a family member. The second thing to know is that you have to really dig in with your plan to understand where you can get services. There are certain services that you can only have in your tax domiciled state. Let's call that Florida, if that's where you've tax domiciled. And there are other services that you have more flexibility in where you receive those. Historically, for folks at Snowbird, the Medicare supplement plans have offered more flexibility to you basically being able to move around and access services where you need them. Historically, the Medicare Advantage programs have been less flexible. I say historically because it's starting to change, but I think, if either you snowbird or you have a family member that snowbirds, you really have to think about um, where are you going to be domiciled and where does that actually mean you kind of take that kind of those primary healthcare decisions. From a caregiver perspective, a lot of the programs that we talked about also relate back to where your family member is based. If you're acting and looking to get reimbursed from some caregiver services, you will need to be based in that area for a significant portion of time to cover it. So if you fly in for a week every 6 months, you're not going to get reimbursed for your caregiving services. I think about those caregiving benefits as being for folks typically who are more permanently supporting a family member in the same location.
Thank you for that, Rhian. Let's see here. What is the difference between a living will and a last will? And how would those affect potential caregiver decisions?
Yeah. So think about the living will as being much more about the healthcare decisions that members are making, whereas the last will is really focused on um, it's the distribution of assets. Really important from a caregiving perspective to be really focused on understanding what the healthcare needs are and whether or not you've actually documented the care that the family member needs.
Well, you've given us amazing information. It looks like those are the questions that we've had come in. I know that my head is spinning just thinking about some of the decisions that will indeed need to be made, right? As I have parents that are, aging and heading into retirement. And so, definitely always, very, very excited to be a part of these sessions. I learned so much. I take a full page of notes that I'm constantly going back to. And so, Rhian, I want to thank you for that. I want to remind those that are attending that you can visit elgacu.silvur.com to access the free retirement score, and it's a helpful tool to see how long your money will be able to last in retirement. Listen, as you, Rhian, when you said that, I want to say it was $2,600 would last a lifetime. I did the calculation, to try and figure out how many years is that, right? And so I do think that it's very, very helpful for people to begin doing the math, taking a look at that retirement score tool, understanding how long their money is intended to last them based on what it is that they have. I have here. I got something that came in on the Q&A, and it's not a question. It just said that you are an awesome speaker, and thank you,
Oh,
Rhian. So
well, that's
great.
very kind.
Great work. And so with that said, thank you, Rhian and Silvur, for being willing to partner with ELGA Credit Union so that we can bring retirement education to our members. As I stated in the beginning, we are trying to be intentional and strategic about making sure that those that need the information are getting the information. And so we appreciate you guys being willing to partner with us. I want to thank all of those that came on today, that decided to attend, that are looking for this information, that are taking in these tools. I do want you guys to remember to keep an eye out, because we will send some details out regarding our next webinar that is going to be coming up in August, and that session is going to be focusing on Medicare, right? And we believe that that's a topic that many people are thinking about and using to plan for their next chapter. And so, thank you so much. And Rhian, just in case you have any last words before we go off.
Yeah, I just wanted to double tap and say, like, I know this is complicated. I think there's a lot to cover, and we covered a lot today. Know that that information is available for you to come back into, because it is not, unfortunately, retirement and caregiving are not things that any of us can master in 1 hour or one afternoon. And so I think in partnership with ELGA, we want to give you the resources so that you can, when you have time, go back in and dive into the topics that really mattered for you, that are important. So if you're feeling overwhelmed, that's okay. That's kind of unfortunately what retirement feels like today. But I do want to say that you're not alone. And I think the credit union is, here by your side to make sure that you're getting the resources that you need.
Absolutely. Well, thank you so much. And everyone,
Thank,
have a great afternoon. Thank you, guys.
thank you.